Hello and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan and I'm a licensed marriage and family therapist from sunny California. I currently work at a private practice where we focus on child anxiety reduction, and I also work for a nonprofit cancer support organization. Thanks for listening. Today, I'm going to be discussing a topic that honestly, I don't know the answer to or know my opinion on it really. Today, I'm going to talk about prevalence inflation or mental health inflation, which is the idea that the surge of mental health issues, especially among young people, is in large part due to us talking about mental health too much. My super cool soon-to-be mother-in-law sent me an article written by Ellen Berry from the New York Times that discusses this matter. In the article, Berry quotes that this hypothesis is called prevalence inflation. It holds that our society has become so saturated with discussion of mental health that young people may interpret mild, transient suffering as symptoms of a medical disorder. Prevalence inflation is a very Googleable term and leads to scientific and non-scientific articles about this topic. Some of the articles are titled How Anxiety Became Content in the Atlantic, or Are Mental Health Awareness Efforts Contributing to the Rise in Mental Health Problems from Science Direct. So people are talking about this. Lucy Folks of the University of Oxford was one of the first behind this prevalence theory. In 2018, when she began teaching undergrads, she recalled they were bombarded with messages warning that they might be in crisis, she said. It seemed like the more we were trying to raise awareness about it, it wasn't getting better. And in fact, it only seemed to be getting worse, end quote. So she started to get critical over the teachings of social emotional learning in schools. I have been seeing more and more over the past few years that schools are implementing mindfulness training for social emotional curriculum in schools. It is interesting because most kids who come into my office and do have this at school feel like they already know everything about tuning in with their emotions, etc., which is awesome that they have some basic understanding. But I also don't really know exactly what they're learning and if there's adequate psychoeducation behind it. In California, the education department does require SEL, social emotional learning courses, in the academic curriculum. And from what I have heard, this could be anything from doing one meditation class once a week to actually learning resources and getting appropriate education and tools. It seems kind of unclear and up to the school on what is actually being taught, and it is not streamlined. There are also nowadays many discussions in schools around mental health and therapy in the form of workshops, speakers, and in the classroom, which I also have some mixed feelings about just because we don't really know, hopefully the schools are picking experts in the field, are picking people who speak developmentally appropriate to the children, but it really is hard to know just what kids are taking in from school. A lot of experts defend school-based awareness, advocacy, and trainings, saying that mental health therapy is still not easily accessible for kids and teens. Child psychologist Zachary Blunkin from Columbia University Medical Center says, especially with teens, we need more universal interventions, not less. It is absolutely true that mental health services can still be rare and not accessible, especially for lower income populations. Because of this, kids and teenagers may wait months to see an overworked counselor or psychiatrist and could land in inpatient programs or the ER because of it. The New York Times article says that generations are growing up fluent in the language of mental health, which is generally beneficial, but can also cause adolescents to inappropriately apply medical diagnoses to typical everyday stressors. Experts who support the prevalence inflation hypothesis say that the increased talk of mental health among young people leads to the overuse of psychiatric diagnoses, and studies have shown that students who label themselves with a diagnosis often feel powerless compared to those who have the same challenges but don't label themselves. The New York Times article says, quote, "The prevalence inflation hypothesis asks us to keep an eye on those excesses. People hurt after breakups and struggle to adjust to new schools. Negative feelings aren't always a sign of mental illness. They can even teach us resilience." End quote. So, what do I think as a therapist? Well, as I said previously, I am not really sure. I definitely think that overdiagnosing is an issue and accessibility to mental health care is an issue. Nowadays, truly everyone is diagnosed with anxiety, ADHD, things like that. And while diagnoses can absolutely help to get accommodations and treatment, the risks of overdiagnosing can lead to overmedicating, excessive treatment, and harm to self image or self identity. It's honestly mainly a systemic issue, in my opinion. And something that really bugs me is that I basically have to diagnose my clients on billing documents, even if I don't really think a diagnosis is warranted, if they want insurance to cover their sessions. And I've actually had usually parents of clients say that they would rather pay totally out of pocket, not have me put a diagnosis code on the billing documents because they are worried about the stigma if their child is diagnosed and labeled as having some sort of mental challenge. It's all just super, super messy. Overall, I definitely think it is concerning that the talk about mental health may be increasing the crisis, and it is scary that there is evidence to support this. I have been thinking about this for a bit in relation to suicide. In grad school and during my internships and talking to other therapists, I have learned that talking about suicide does not make it happen. I learned that this is a myth and that by talking about it, we do not make somebody think about it more. If someone is thinking about suicide, talking about it won't increase their suicidal ideation. And it actually destigmatizes it and it opens the door for communication. I completely agree with all of this still. And I think that talking about suicide openly, the increase of resources, community, and treatments has saved so many lives over the years. However, I do have mixed feelings about talking about suicide so openly with kids, and especially teens. In the last few years, there has been a huge uptick in teen suicides. And I do fear that since we talk about it more, they see it as an option for them. Teens are especially impulsive, and this is terrifying when it comes to suicide. I fear that because we are talking about it more, kids, especially impulsive teens, see it as an option. I've actually noticed in my years as a therapist that suicidal ideation has increased a ton over the past few years. Kids are talking openly about death, wanting to die, and even sometimes have detailed thoughts on how they would attempt suicide. Another New York Times article that I've linked in the episode details this drastic change that American adolescence is undergoing. It says, quote, "The gravest public health threats to teenagers in the United States came from binge drinking, drunken driving, teenage pregnancy, and smoking about 3 decades ago. These have since fallen sharply, replaced by a new public health concern, which is soaring rates of mental health disorders." End quote. Some stats from the article that come from the Centers for Disease Control and Prevention report that in 2019, 13% of adolescents reported having a major depressive episode, a 60% increase from 2007. Children and adolescents' emergency room visits in that period also rose sharply for anxiety, mood disorders, and self-harm. And for people ages 10 to 24, suicide rates, which were stable from 2000 to 2007, leapt nearly 60% by 2018. Many hospitals and doctors have called the rising levels of mental health a national emergency. And a lot of experts do attribute this to social media, an epidemic of loneliness, and rising pressures for kids and adolescents. In my opinion, there are also great things about talking about mental health with kids and adolescents, especially in schools. I often say that I wish there was more education around anxiety and mental health when I was a kid, because it could have prevented a lot of suffering and uncertainty for me. It is also awesome to teach kids mindfulness and coping skills to deal with big emotions and life stressors, because they can carry these coping skills with them for the rest of their lives. So, mixed feelings, mixed thoughts, and I would love to hear your thoughts on this matter.
If anyone listening is struggling with their mental health, please call 988 or 911 to get help, reach out to loved ones, and know that you are not alone. Thank you for listening to Just Therapist Things, and I will talk to you soon.